Hello, this is clinical reflection number 7. Today was a good day. It was a very busy day because we had a few patients who had some diagnoses that were kind of critical. To me, it was critical. They had a lot going on. It did involve actively monitoring them and just hourly rounds for vital signs. But this one particular patient I'm going to talk about, 70-year-old male patient, he was admitted for paroxysmal AFib with RVR, and that's rapid ventricular response. He was also admitted for pneumonia. They did a chest x-ray on him and confirmed that he does have pneumonia. Um, he was also admitted for alcohol abuse, um, also acute hypoxic respiratory failure, and also lactic acidosis. So this patient does have a lot going on. He is Q4 vitals. And we also, since he is admitted for alcohol abuse, he was also Q4 for the CWAL test, so CIWA. That test is basically for individuals who, used to drink a lot, who could possibly be experiencing alcohol withdrawal. So we had to do that for him. Performing that CWAT assessment on him was pretty interesting. I liked the setup of it. In the system, he had a medication called lorazepam, and it's kind of like a antidepressant, but it kind of helps prevent seizures because some patients dealing with withdrawal can, have seizures. So depending on his CWAL level is when we would administer the lorazepam. So upon his admission, mind you, he was admitted on the 9th. This is my first time seeing him. This is my first time, me and my nurse actually having him. Um, he has not taken lorazepam because his CWAS score is always less than an 8. If it's above an 8 is when there are certain doses of the medication is what the patient will receive. So basically, the lowest the CWAS score you got, and if it's under 8, you don't need any doses of it. But if you do score like a 8 or above, or maybe you'll get like 1 or 2 doses of it, but the higher the score, the more doses that you get, because that just shows that you are experiencing those withdrawal symptoms, like maybe hallucinations, um, maybe possible seizures, altered mental status. So it's not a good thing that some of these patients couldn't be experiencing. So that was pretty interesting to me. He does have a history of myocardial infarction 2 times, so he had that twice. He does have coronary stenting in place. He has 3 of them put into place. He has a history of hypertension, hyperlipidemia, and hypothyroidism. So we did have to administer some levothyroxine thyroxine to him for the hypothyroidism. He also has a history of coronary artery disease. Um, that's the why he got those, stents placed, and that does explain the history of MI as well. And then alcoholism, because he's admitted for the alcohol abuse. He was experiencing some difficulty swallowing, so therefore he does have a consultant for speech therapy. With speech therapy, they came in and basically did a few tests with him. They tried the swallow test with him through a cup. They tried it through a straw. He did fail each one, so therefore he was placed on precautions, right? And so his diet, he was on a cardiac diet, but he had to have nectar thick liquids. Um, and cardiac soft bites and no straws was added to his diet. So that's something that did change. It was very interesting just to see how they had the substance that thickens liquid, and according to your score that you get from speech therapy is how much we know of the liquid nectar, the thick liquids that you need in your drinks and stuff to make it thick enough that you can tolerate. That was also something interesting for me. For this patient, he was mild confused. He was a little confused. His lower extremities were weak. I did have a chance to listen to his lung sounds. You did hear some, they were very diminished. You hear a little bit of like wheezing. Um, I did perform a full assessment on him. Everything was pretty much normal with the placement and everything. Skin was pretty dry. He did have a sacral on his. He did have a pressure injury, maybe like a little small pressure injury, a little minor. Most likely, it looks like it maybe can due to like maybe just being on bed rest for so long. We had to monitor that and just perform minor wound care for that area. We had to wrap it nicely, cover that area so it's like not pressing up against the bedding and on the hard parts, causing more irritation. Um, so this patient was very interesting. He did require assistance with getting up, but he didn't really need to get up. He did have on a catheter, a fully catheter in place, so he was able to do that. But like I said, today was a pretty busy day, I would say, for me and my nurse. Me and her really were working just to make sure every patient was comfortable and made sure we administered medications in time and came to their needs in time. I did provide compassionate care um to my patients today. Many of them, they did have like a lot going on with their situation. Some of them were depressed. So just being another person there with them, just sharing the opportunity to help them and make them feel better, just developing conversations with them, maybe getting their mind off of their condition. They've been in the hospital all day. So I'm always there to light up their day and spread joy to them in a way that I could. Um, and just try to interact with them, maybe get their minds off what they're, worried about and think about other things. So, just providing compassionate care, honestly, to each patient that we went to today. Because each patient to me did seem a little bit down. Even though it was late, a lot of them, they were up, couldn't sleep, but um, just having like little conversations with them before moving on to the next patient was something that I wanted to do for the patients today. Is what I would say. So something I did learn today that many patients dealing with alcoholic withdrawal can possibly develop Wernicke-Korsakoff syndrome. Um, basically, that's spelled WERNICKORSAKOFF. Basically, if they have maybe like deficiencies in their vitamins, like for this patient, he had orders, like actual orders to be administered folic acid, 1 gram, and thiamine, which is like vitamin B12 and vitamin B1, 100 milligrams is what he was administered, because he was lacking that. So we had to do Q6 hourly vital signs for him and make sure his everything was stable. But if that was to drop in the labs and everything, we needed to administer that so he does not develop that syndrome. But that's it for today. Thank you. I had a good day today and learned a lot.